If you're living on a fixed income and your Medicare drug costs feel like they're getting harder and harder to manage each year, you're going to want to watch this entire video very carefully. Because most people don't know this, but thousands of seniors qualify for financial help through Medicare's low-income subsidy program, also known as Extra Help, and never apply. And the biggest reason is simple. No one ever told them they were eligible. Today, I'm going to walk you through exactly what Extra Help is, how much money it can save you, how you may qualify even if you think your income is too high, and how to secure these benefits before you miss out. Most seniors think this program is only for extremely low-income households, but that's not true anymore. The rules were expanded, the income limits increased, and more seniors are qualifying than at any other time. You might be one of them, even if you've been denied in the past, so don't go anywhere. Every day, I meet seniors who are spending $200, $300, sometimes $400 a month on their prescriptions, while living on a Social Security check that barely keeps up with inflation. And when I ask if they've ever applied for Extra Help, they look at me and say no because they thought they made too much to qualify, or they were afraid the application would affect their Social Security benefits. Let me clear this up right now. Extra Help does not reduce your Social Security check. It does not affect your Medicare eligibility, and it does not interfere with your other benefits. But what it can do is dramatically lower your prescription drug costs under Medicare Part D, and in many cases, it can drop your monthly premium to zero. Imagine having prescription costs that used to be hundreds, now reduced to just a few dollars per month. That's what Extra Help can do, but you have to take action to see those savings. Before we go deeper, think about your current prescription costs for a moment. Think about the number you spent last month, or the last time you picked up a medication and the pharmacist told you the price. Now imagine cutting that cost by 70%, 80%, sometimes even 90%. That is the real impact of Extra Help. And for many seniors, especially those in their mid-60s to late 70s, this program isn't just helpful, it's life-changing. Most seniors using Extra Help tell me the same thing. They wish they knew about it earlier. In fact, some of them were eligible for years and never applied. Don't let that be you. Now, Extra Help has two big parts. It reduces how much you pay at the pharmacy, and it can eliminate your monthly Part D premium if your plan participates in what's called the benchmark level. This means you could end up paying $0 per month for your drug plan. Even if you currently have a drug plan you're paying for, Extra Help can remove that cost. And on top of that, Extra Help also covers your annual Part D deductible and lowers your copays to very affordable amounts. In many cases, generic drugs drop to a couple of dollars, and brand-name medications that used to cost $45, $60, or even $100 can drop to much lower amounts. And at the catastrophic level, which usually hits when your drug spending reaches a certain point, Extra Help protects you from high out-of-pocket costs entirely. But the most surprising part for many seniors is that qualification doesn't work the way they imagine. Most seniors picture strict income limits that only apply to extremely low earners. But for 2025, more people qualify than ever before. Social Security income, pension income, part-time work, and retirement withdrawals all factor in, but the limits have been expanded so significantly that millions of seniors now fall within range. And here's something else you need to know. Extra Help doesn't look at your home, your car, or your personal belongings. Those do not affect eligibility. And many seniors don't realize that having a little money saved doesn't disqualify them either. The program is designed to help real people who are struggling with real prescription costs, not to penalize someone just because they tried to save responsibly. This is where most seniors make a mistake. They assume they don't qualify without ever checking. They make that decision for themselves before letting the actual rules decide. I've seen seniors deny themselves thousands of dollars of savings because someone once told them they wouldn't be approved. But the current rules are different from the old rules. If you haven't applied recently, or if you've never applied at all, you simply don't know where you stand. And something as small as paying for Medicare Part B out of your Social Security check, or having higher medical costs, can shift the balance in your favor. One of the biggest benefits of Extra Help is stability. Medicare drug plans change their premiums and formularies every year. A medication that was affordable last year can suddenly become expensive, but Extra Help protects you from feeling that full impact. Instead of those rising costs hitting your wallet, the program shields you. And during the coverage gap, often called the donut hole, seniors without Extra Help can face extremely high costs. But if you have Extra Help, the donut hole essentially disappears for you. Your costs remain steady instead of spiking. Now, I want to talk about something very important: timing. Many seniors wait until they feel overwhelmed by prescription costs before they take the next step. But the truth is, the earlier you apply, the sooner you lock in those savings. And if you become eligible and are approved, your benefits can often begin the first month after approval. But you must take action before it's too late. Every year, thousands of seniors miss months of savings simply because they put it off too long. Don't let that be you. And if you're watching this video right now, you are already ahead of most people your age. You're learning about a benefit that many seniors don't even know exists. Now, I want you to stay with me here because I'm going to walk you through something that surprises everyone. A lot of seniors who don't qualify for Medicaid still qualify for Extra Help. And many seniors who think their retirement income is too high discover they're still within the allowed limits. Widows and widowers especially fall into this group. Once a spouse passes away, the surviving partner often loses household income, but keeps the same expenses. Extra Help can fill that gap and bring immediate relief. And if you are caring for an aging parent or helping someone in your family navigate Medicare, make sure they know this program exists. No one should be choosing between medication and groceries when help is available. Let's talk about another common fear. Some seniors worry that applying for Extra Help means the government will look into their bank accounts, or that it will lead to complications with other benefits they rely on. That is not how the program works. The process is designed to be straightforward and senior-friendly. It does not force you to report every detail of your personal life, and it does not affect your Medicare coverage or your Social Security benefits. If anything, it protects them by making your prescription costs more manageable. And once you qualify, you don't need to reapply every year unless your situation changes significantly. For many seniors, approval lasts automatically from year to year, making it one less thing to worry about. Now, if you're watching this and thinking, "This sounds good, but I'm still not sure I qualify," let me say this. The only way to know for certain is to check. Not guess, not assume, but check. Seniors who take the small step to review their eligibility are always glad they did. Some discover they qualify for full Extra Help, and others qualify for partial Extra Help, which still provides significant savings. And here's something many seniors don't realize. If you're approved for Extra Help, you also gain access to a special enrollment period. That means you can switch your Medicare drug plan outside of the normal enrollment windows, allowing you to move into a plan that fits your medications better. Now I want to give you a quick scenario that might sound familiar. Imagine a 72-year-old senior on a fixed income. She pays for 5 medications each month. 2 generics, 1 heart medication, 1 inhaler, and 1 blood thinner. Without Extra Help, her monthly cost is over $180. With Extra Help, her cost drops under $20. That is the difference this program makes. And if you think savings like that only apply to others, not to you, think again. You may be much closer to qualifying than you realize. Before we continue, if you find value in clear, trustworthy Medicare guidance like this, take a moment right now and subscribe to the Medicare Mentor channel. It helps the channel grow, and it ensures you never miss important updates that can save you money and protect your benefits. Now, let's continue. Another thing seniors worry about is whether their spouse must also qualify for both of them to receive benefits. But that's not how the program works. Each person is evaluated individually, even if you live together. And if only one spouse qualifies, that spouse can still receive the full benefits of Extra Help. The program is designed to make healthcare affordable for the individual senior, not just for the household. This is especially important for couples where one partner takes multiple medications and the other doesn't. The spouse who needs help can receive it without affecting the other. Now I want to talk directly to the seniors who feel overwhelmed every time they visit the pharmacy. You should not have to stand at the counter hoping your medication is affordable. You should not have to reduce your doses just to make your prescriptions last longer. And you should not have to keep choosing between paying bills and managing your health. You worked your entire life. You paid into the system. This program exists for you, and the only thing standing between you and these savings is taking the next step. Many seniors think applying is complicated, but the truth is that most of the process is simpler than enrolling in a Medicare plan. And if you need help understanding what documents you might need or what information is required, there are plenty of resources available. You don't have to figure it out alone. Every year, I guide seniors through this process, and almost every time they say the same thing afterward. They wish they had done it sooner. Another major misunderstanding is this. Some seniors think extra help is only temporary or only available during certain Medicare enrollment periods. That is not the case. You can apply at any time of the year. Morning, afternoon, summer, winter, during annual enrollment, outside annual enrollment. It doesn't matter. The program is always open. But what does matter is doing it before you spend another year paying more than you need to. And the sooner you apply, the sooner you begin receiving relief. Let me share something else that often surprises seniors. If you qualify for extra help, you automatically gain protection against plan changes. Every year, Medicare drug plans adjust their copays, deductibles, premiums, and covered medications. Some get more expensive, some drop important drugs. And regularly reviewing drug plans becomes important for most people. But extra help reduces the consequences of these changes. Your costs remain low regardless of what the plan does. That means less stress, fewer surprises, and more stability in your budget. Seniors often ask me whether extra help covers high-cost medications, especially brand-name drugs. The answer is yes. And not only does it cover them, but it usually reduces them dramatically. Even medications that cost a few $100s typically drop to a far more affordable amount. This is especially helpful for seniors managing chronic conditions such as diabetes, heart disease, COPD, and other long-term health issues. The program doesn't pick and choose which drugs to help with. It applies across the board. Now, if you're still watching, that tells me something important. You're serious about learning how to reduce your Medicare costs, and that means you're already ahead of the majority of seniors who never take the time to understand their options. That also means you're exactly the kind of senior who benefits the most from programs like Extra Help. So here's what I want you to remember. This program is not charity. It is not welfare. It is a Medicare benefit designed specifically for seniors who need financial relief. And the only thing you need to do is check whether you qualify. Before we close, I want to leave you with a clear next step. You now understand what Extra Help is, how it lowers your prescription drug costs, why more seniors qualify than ever before, and why waiting only delays the savings you could already be receiving. If you want more guidance like this, subscribe to Medicare Mentor so you never miss updates that affect your Medicare coverage and your wallet. I'm here to help you stay informed, confident, and protected as you navigate Medicare. And if this video helped you today, it will help someone else you know. Share it with another senior in your life who may be struggling with prescription costs. You deserve affordable healthcare. You deserve peace of mind. And you deserve to keep more of your hard-earned money in your pocket. Take the next step. Check your eligibility and let Extra Help do exactly what it was designed to do. Make your Medicare costs manageable and give you the support you've earned. Thank you for watching, and I'll see you in the next video.